Hello, everyone. Time again for another Adventures in Aberrant Psychology. It's been a while since my last one, but I've got plenty to talk about. Let me just dish on my whole week. And hopefully, this whole series helps anyone who wants to get into the field as far as what to expect. A lot of people don't get into healthcare fields because they're expecting, somebody who uses their own feces to draw on the walls will be the norm every day that they'll just walk into. Or, a lot of blood. Some people don't become nurses when they would have been good nurses because they don't like the sight of blood. It's a very large percentage of the population fear just blood. So, hopefully, people will watch this series and they'll just learn what it's actually like rather than, what they're afraid of. So, let's see, last week I started the week with a girl who, when I walked in to the hospital, to the ED room where she was being held on an M1 hold, she was having her bed removed because the two officers, both female, that were watching her, and then they called in for a behaviorist because they couldn't be stuck not doing their duties. They were taking things away from her because she was not complying. Apparently, she had to be held down to even be put into a green gown. I didn't see that part, but she was having her bed taken away because she moved the bed because she saw the camera in the room, and she was trying to avoid being seen by the camera. So she moved it in order to hide behind it, which is a no-no, so they took the bed away. They left the mattress and a pillow. Well, in my view, these two officers were being a bit harsh, and when they looked back upon the patient, they found that she was holding the mattress like a shield in the corner, trying to shield us from being able to see her. Again, not something that we can allow because we have to maintain line of sight on these patients. So they went in and they took her mattress away. Then she was down to a pillow and a blanket. And of course, 2 minutes later, she's holding the pillow in front of her face, balled up in the corner, trying to hide from the camera. And at that point, it was my charge, and I actually planned to give her some of those things back, and talk her down and be a little bit nicer. But the nurse came along and decided that she was getting a very large sedative, so we had to go in there and hold her down, which actually went very well. No punching, no kicking. The laying on of hands happened with many people involved, and she got her shot. Then everyone left, and it was just me watching her on camera and her in the room. She was in the corner, hiding her face in the pillow, which, I could see her breathing, so I was just going to give her that, And when she finally fell over from the sedative, she put the pillow in the way of her head, and she was just on the floor. I went ahead and put her mattress, which was in the hallway, back on the bed and wheeled it in. And I had this moment where I was thinking, do I wake her up to put her in the bed, because she might be a handful, or just leave this here? And I was like, I'm just going to leave this here. And it worked. About 5 minutes later, she stirred, she looked over, and she saw that there was a bed instead of a floor, and she got into it herself. And I did not have any problems with her the rest of the night. I left a couple cups of water for her, but she slept the rest of the night. Next patient I had was one of those patients where the marvels of the human mind get known. This guy had surprisingly a large number of visitors for a white guy. And it's not a racist thing, but it's something of an observation on race that white guys normally they get their wife or their mom. And this guy had a lot of friends, especially for someone who was mentally handicapped. What happened was, in the prior 2 years, he had gone from a fully functioning adult into dementia, mostly due to deterioration of his temporal lobe. His wife was still strongly standing by him and was prominent among the guests he had that night. Some of his guests, though, seemed to be from different institutions that he might have visited, because they were all of a less than 100 IQ. Those that I'm talking about. But he had family and friends visiting, and it was neat to see that he still had a support, because lesser people might not take as seriously that whole vow to be next to someone in sickness and in health when you marry them. I see that a lot, that people just get dumped on the system, and you're like, well, where's their spouse? Yeah, they went on to greener pastures, I guess. But this guy, he had a strong support group, and what was interesting about his case was his vocabulary had been reduced to something of saying yes or no, which sounded very similar, like yeah or no, and no bullshit. That was the third thing he could say. No bullshit. And I think he could say that because very often people didn't think that he could comprehend what they were saying, and they were just lying to him in order to get him to do things, and he'd find out that they were lying. And so, in his vocabulary still, to the end, is no bullshit. During the night, he was due for a procedure which kept him from being able to eat until the procedure was over, but he kept on being bumped for that procedure, and so every time they said, okay, it's going to be another hour, he would say, no bullshit! So his life was getting a little bit frustrating for him. More interesting than any of that was the fact that he could carry on a conversation by writing it, which stunned me. Speaking, he had, 3 phrases at all that he said the whole night and could have said. But writing, he knew many words, and he could still use his cell phone to text his wife and have more of a conversation with texting than he could have face-to-face. The whole reason I was watching him was because he had a bit of a violent altercation with a nurse, which required behaviorists to watch him 24/7 for the rest of his stay in the hospital. He wasn't acting up while I was watching him, he was pretty calm. But his friends brought him some fast food, which helped a lot. Skipping on in my patients that I saw in the past few weeks, I had one patient that was in for suicidal ideation that kind of made me sad because she was pregnant and the same age as me. And by the time that she left, She was released to herself. She had another evaluation, and they figured that she could do with outpatient treatment. I was just happy to learn that she had a name picked out for her baby, because that gave me a little bit of hope that she would make it to term and not end up killing herself and her baby. It was one of those things where you're never really in the mind of the patient, and sometimes you're never going to understand what's going through their head as far as, how could you kill yourself when you're supposed to be making decisions for two, you know. I had another patient who was, in my opinion and in the opinion of his evaluator, ready to go home and maybe seek some outpatient treatment and maybe go on a trip to another state with his family, where he would become a problem of that other state, because when I say trip, I mean they wanted to move. But he was being held because he was already a resident of a halfway home, where the psychiatrist that was involved with the institution of the halfway home had put in his notes that he should be placed on a hold, and it was a fight between his current evaluator, seeing his needs right now, and what was in his charts, what someone had written down, because they wanted to make sure that he was seen for his underlying issue, which was he kept not taking his medication. And it's tough to be watching someone and keeping them against their will when there really isn't a problem with them at that moment. They could be sent home and they could be enjoying all the luxuries that they have at home, and instead they're there with you. I had another patient that came at the very end of a shift for me that I only watched him for 2 hours, but the reason why he was in my emergency room and kept me there, because I had another patient that got released, which meant I could go home because I didn't have any other patients, and then this guy comes in right at the end of the shift and extends my stay in the emergency room. I watched him for about 2 hours. The reason why he was there: he was suicidal, but he was in a jail, and he was there for some sort of domestic abuse. There was some altercation, and he was charged with a misdemeanor, not a felony, not a life-changing event, really. It was just a misdemeanor, and he had a couple of other court orders keeping him from seeing the people that he had the fight with. But the reason why he was in the emergency room instead of seeing a psychologist inside of the lockup is, upon receiving his papers releasing him from jail, he looked up and told the sheriffs, "I think I just want to kill myself." There were plenty of people in the lockup whose job it is to deal with those issues in the lockup, and they're better at it because they know certain resources that you can give to somebody who maybe has a court order barring them from going back to their own house, But once he got the papers in his hand releasing him from the jail, he was no longer able to get to those resources. He's not under their care anymore. He just happened to speak to the person giving him the paperwork right after getting it. So they had to do something. So they put him in the emergency room in the closest hospital they could find that wasn't on divert. Turfing. It's sometimes an ugly thing. Most times it's an ugly thing. I don't want it in my backyard, so here, have at it. So then I led him through a couple of things while he was with me, and I was assuming that he was in the wrong. I just make the assumption because, that's what he was charged with. But I helped him out as far as telling him how to get a doctor's excuse that is privacy friendly, so that he might be able to explain his day or two away from work by just saying he was seen in the hospital during that time. And he doesn't have to say what it was for, and he could say anything, and we can't verify anything anyway over the phone. But at least that much might help him, I guess, salvage his work life, and then he can go on from there, because it looked like his home life was about shit at that point. He was about to lose a lot, and that's why he was suicidal. He was a fairly muscular man, too, but he was not at all scary. That's something that I deal with a lot, where people see muscles and they infer that that person is violent. And many times I just come across people who are very fit, who just happen upon the worst day of their lives, and they're not really going to be violent. As a general rule, the most violent patients I come across are women who are less than 130 pounds. Around 120, a girl feels like it's still okay to punch and kick and hit a very big man such as myself. And at that point, it's really strange to see what happens when we switch out behaviorists and give her off to a woman behaviorist to watch her, or a female CNA, because they're not nearly as violent to them as they think it's okay to be with men that are large. My belly has been the punching bag for a couple of them, and I basically stand there hugging and waiting for assistance, because it's not hurting me. But it is very inappropriate for them to believe that it's okay in any setting to be hitting large men just because they can take it. But that's the world we live in. So, last patient I'm going to tell you about, I had to watch for 3 12-hour shifts this past week. We're going to call him Patient J. So far, patient of the fucking year. Okay? Patient J was not suicidal, barely homicidal towards staff, barely. Mostly just a psych patient because he was off of his medications. He also had a very strong woman in his life who he was about to get married to. I don't know if that affected their plans as far as when they're going to pull it off, because he'd have to have some pretty quick jaunts through the system in order to make his wedding date. But this man had a reputation over the last 7 years for about every 6 months to a year showing up in the emergency room and staying for about a month before placement because of his size and his unpredictability as far as violent outbursts. What happens is he figures for whatever reason he can go without his medication. And in the emergency room setting, it takes about 20 days of applying this medication to him in order to titrate up to the levels where he can think. And over the course of a very spread out 3 shifts, I was able to see a dramatic change in this patient's behavior. But the first few days were absolutely brutal for me to be watching this guy. He was urinating on himself, even unrestrained. He was restrained parts of the times, and restraint protocols where you're not allowed to restrain someone where they're sleeping were enacted because that would be assault. And my license as a behaviorist isn't at issue. It's the nurse's license that's in charge of him. That's who is risking their license if they continue to restrain a patient. So he would fall asleep in restraints, and we'd take the restraints off, and he would sometimes wake up, walk around, get right back into his bed, and then still wet himself when there was a toilet in the room. His floor reeked of urine. We couldn't get in there with housekeeping, environmental services enough because, he was unpredictable, and we couldn't, have them moving around his bed while he's sleeping because it might wake him up. They'd go in there with a quick mop, but still there was funk building up in there that we just couldn't deal with without risking harm to ourselves. There were moments that he would try eating things, and he was just the messiest eater. It was like he had reverted into a 5-year-old state. When he did start being manic and tossing things around his room, those things would get into the corners that weren't well mopped and get urine on them. And then he kicked a pillow, and it hit me on the leg, and then my leg had urine on it. And I had about 3 hours left on that shift, and I was not happy. Not happy at all. I was particularly disgusted by him being messy with his food and being given fruit, and a strawberry had fallen out of his hands and gotten onto the floor, and before I could stop him, he grabbed it and ate it. It's really frustrating when somebody starts saying, "You don't have the right to hold me here," which is so common that people in America think that they have rights that cannot be violated for any reason, including when you're crazy and threatening people. No, you don't have the right to do that, and there are people with licenses that can take that freedom away from you to walk out the door. At one point, he was conversational with me, and he was demanding that I get a football from behind the nurse's desk. And I said, "There are no footballs." He said, "Yes, there are. Let's play some football. I'm pent up in here. I got nothing to do." And he's screaming at me, "I want to play football." And I said, "You can't play football because you're going to put a window out." He said, "I'm not going to put a window out. I have great aim." And I yelled back at him, "Why is there piss all over the floor then?" And at that point I realized that I was having a conversation with a crazy person, and I was getting sucked in, like really arguing with him on that level. It's just not productive. But damage to the room included, the whole bed is probably going to have to be replaced. At one point, he tried pulling the bed by the bed rails while the bed was locked in place. They have brakes on the wheels, right? And he tried pulling on the rails to get it to go sideways because he wanted to get a better angle on watching the TV. And his feet slipped in his own urine. His legs went under the bed, and the back of his head fell and hit the wall. And he thought that I had punched him from behind and tried to knock him out. And that was one of those times where there were a lot of people standing in somebody else's urine trying to help him, but nobody wanted to really get in there. You know, it's that ick factor of, ugh, he's covered in his own urine. We tried many things to clean him up. He went through so many paper scrubs that we would give him because we couldn't get a gown on him. He flat out refused that, and that was just such a fight that we started giving him paper shirts and paper gowns, and he would go through 5 or 6 in a 12-hour shift, one every 2 hours, which just runs up, the healthcare bill that he's going to have. And this guy actually had insurance. I can't say what he did for a living, Patient J, but I will say that he had a well-to-do job, and every time that he had one of these benders where he went off his medication, he was basically cutting the legs out from underneath himself, which is sad because as a normal person with medication, when he could actually think, reports from his fiance were that he was very intelligent and did very well, and every one of these attacks was really hurting him professionally. Patient J, as I'm calling him, also has another nickname, which is the Pizza Man, and behaviorists all over the metro area know who he is because on a couple of his stays, people have found that pizza is the easiest way to get him to comply with anything you want him to do. It will take him from a rage to a munching Ninja Turtle type person, just eating and doing whatever. Give up the arm for the blood pressure. Yeah, just give me a slice of pizza. And the pizza is so powerful in his life when he is unmedicated that he will try to hide the pizza from the nursing staff. He'll try to hoard it. And on previous occasions, he has, even though his bed has been urine soaked, he has taken the entire box of pizza and tried to hide it underneath his mattress, which then the cardboard gets some of the drippings that come off of him. And, ew, he has also attempted to hide pieces of pizza in the bathroom in places like inside of the toilet paper roll and around the toilet paper, and the toilet paper goes into a hole because they don't want people breaking off fixtures. These rooms are designed to have the least amount of ways that you could hurt yourself. Yeah. I never want to see him again. I might have to in the coming months because he might have a very, very long stay. But I don't want to see him in his real life doing well. I don't. I'm happy just clocking out at the end of that shift. It is so hard. And the frustration really comes from watching someone who appears to be sleeping and then 10 minutes later they're up again and you have to deal with it, and then you sit down for 5 minutes and then you're up for another 5 minutes, and there's no calm. There's only anticipation of another outburst, and constantly being on your feet to deal with a situation that's just off the wall because this guy actually does have an intellect that's working to perform the will of a 5-year-old, and just thinking up all sorts of different things that just really tax you, you know. Um, it's what it is to be a behaviorist sometimes. You get that one patient that you feel like 2 or 3 dissertations wouldn't cover how hard it was to deal with him.